And this is my journal club presentation. The article that I covered was The Power and the Promise Working with Communities to Analyze Data and Interpret Findings and Get to Outcomes. Why did I choose this paper? So for me, when I was looking over all of the different assigned papers, it really struck me how much I didn't see a whole lot of involvement in analysis, and how much through what I've been doing in grad school I've viewed the importance of analysis, who controls that analysis process, what are the ideology and lenses of the people who control it, and how is that translated into the actions that come out of it. People who may have certain ideological lenses may lend them to view the data in a certain way and thus lead to certain outcomes that all coalesce with that ideology or that lens. So involving other people that may cause some levels of friction in that I think can be a very positive thing. I included in here dialectics, which is something that I think is important in this process, and that is basically, in its most summarized version, is the taking of various viewpoints and ways of looking at a particular object, problem, etc., the perspectives of all those people, and resolving all of those contradictions to come to a more complete view of the truth of the matter. And I actually included a quote from the article that really made me think of that. As one of the participants said, what we are doing is comparing what we think and know to what others think and know. We then walk away knowing more. And I think really that's the essence of dialectics, and in a lot of ways the essence of why I chose data analysis and doing that from a CBPR standpoint involving community as what I wanted to cover for Journal Club. The general description of CBR problem addressed by this article is summarized, I think, in these two quotes. Although the intent of community-based participatory research is to include community voices in all phases of a research initiative, community partners appear less frequently engaged in data analysis and interpretation than in other research phases. And also the strongest and most common engagement occurred in recruiting study participants and designing and implementing the research and interventions. Less common was community participation in data analysis and interpretation findings. So trying to figure out how, what's going on here. Why is it that community seems to be less involved in data analysis and interpretation of findings? The issues in coming up when solving this problem and trying to get community more involved in data analysis seems to be primarily around time and energy. There was reports of people feeling like the community would be better served doing other things, being less involved in this aspect, and allowing this to people who already have the skills instead of having to learn them. And that maybe overwhelming community members too much, having to place this kind of burden of data analysis and interpretation, and also lengthening the process considerably. Also, there was a point that sometimes communities prefer that the academic institutions or partners are the ones that interpret the data, and that may be because of that lack of capacity in terms of time, energy, or skills. So the goals of this paper, as I view it, was to suggest that including community partners in data analysis and interpretation, while lengthening the project time, and enriches insight and findings, and consequently should be a focus of the next generation of CBR initiatives. And they tried to really prove this by answering the questions listed here, which is what are the complementary roles and skills for academic and community partners? How can academic and community partners anticipate the time and iterative process required? And is engaging all partners in data analysis, interpretation of findings, or both, worth doing and doable? The methods that they used to answer these questions were to evaluate 4 case studies from their own CBPR studies, to provide examples of how community members participated in data analysis, interpretation, or both, and thereby strengthening the community capacity and providing unique insight. The four that they chose to cover four CBPR studies that they covered were building public health infrastructure and assessing capacity in a tribal community. And that case study was a partnership between faculty and students from the University of New Mexico, the Albuquerque Area Indian Health Board, and the members of a nearby tribal community. This partnership was forged to assess the tribe's public health infrastructure and capacity to improve health. Here, the participants use mixed qualitative and quantitative analytic methods. And the second one, developing the East Side Village Health Worker Partnership. This case is a partnership carried out in Detroit's East Side involving participants from community-based organizations, the local health department, an integrated care system, and faculty, students, and staff from the University of Michigan School of Public Health. In this case study, community partners interpreted results from a community survey aimed at examining and addressing social determinants of health. The third case, improving Latino men's health, is a partnership between the North Carolina Latino Men's Soccer League, other community-based organizations, and the faculty at the University of North Carolina's School of Public Health. They use focus group methodology to understand issues related to sexually transmitted infections, particularly HIV. And finally, tackling environmental health issues in an urban community. This one was a partnership between neighborhood organizations in Brooklyn, particularly the Williamsburg and Greenpoint area, and faculty from the Hunter College, Queens College, and City University of New York. They use mapping as a methodology for documenting environmental health. And as I mentioned, the methods that were used were both qualitative and quantitative. Focus group surveys and mapping were the three that they highlighted specifically, but they didn't go into detail into some of them. The case represents for the methods employed, the cases that they presented represented a range of methods for data analysis or interpretation of findings, and so they are using them to review the collaborative processes that were employed, identifying challenges met in data analysis, interpretation of findings, or both, and the impact each partnership had. They're discussing how community and academic collaboration added value to the analytic and interpretive phases of research, and And finally, highlighting the lessons learned across the four cases, which we'll go into later. So for the evaluation of the methods, I saw that maybe these four cases would not be enough to be convincing of all the benefits of engaging community in data analysis. Do these four cases really cover the scope of all the situations in CBPR that determine whether or not involvement of community in data analysis should be done based off the vast amount of time that it may take and effort? So that was something that I noticed as possibly a hindrance in this article. I put the example here of Eastside Village Health Worker Partnership that it took over a 6-month period with 12 steering committee members and 25 village health workers participating in all these meetings to coalesce all the data analysis and interpretation. And even if you look at the Improving Latinos Men's Health, that one took 8 months to evaluate the data with 9 members. And it involved both English and Spanish speakers, some who were not bilingual, so having to have interpreters present and having to interpret the data and the coding and the findings in both languages to facilitate the dialogue and conversation could be very cumbersome. And so trying to understand if these 4 case studies are enough to really be convincing and conclusive to CBPR researchers that they should take on these tasks and the benefits behind taking on these tasks. So for the results, the article concluded that the importance of and or underscore the importance of an approach that creates space for both community and university partners to draw on their different yet complementary experiences and skills, and to determine the respective analytical roles and responsibilities for each of these research phases. So that will go into a little bit more detail in the next 3 slides, where I talk about the lessons learned about the variety of skills and how to navigate and negotiate those, and the different roles to be played by community and by the university partners. The other thing that I thought was important to highlight in their results was that they viewed it that the time and the iterative process necessary for achieving common ground and understanding of data analysis and interpretation, um, that university partners really had to be intentional about avoiding to use jargon and particular terminology related to data analysis. And so this linguistic component was essential, not just in jargon and linguistically in the English language, but also recognizing that within these communities, there are so many people who speak so many different languages, where you had people who were of Polish backgrounds and only spoke Polish or Yiddish or Spanish. So then how do you try to allow people to speak and operate in their strongest language, or a shared language? So they used maps and they used graphics and things like that to present data in a way that was able to bridge some linguistical gaps, including people who spoke English but just may not speak English on the same terms that university partners may. So I thought that that was a very important result being drawn out there through this analysis. Um, and also recognizing that significant research findings were not a replacement for their community partners' vision for developing and implementing intervention. So recognizing that the data had to be applied to these people's material realities, and understanding what their visions are, and what interventions they saw fit based off their lived realities, and how that can be in communication with the research findings rather than replacing it. So, as I said, these are kind of the lessons learned that the article highlighted based off analyzing these 4 case studies. And so the first ones are, and they're broken up based off the 3 questions that I had mentioned earlier as the goals of the article. But the first one being, what are the complementary roles and skills for academic and community partners? And academic and community partners' respective roles in data analysis and interpretation of findings should be determined collaboratively. And this was very important in the sense that they wanted to make sure that though there may be times where academic and community partners work collaboratively on data analysis and interpretation of findings, there may be times that community partners only want to be involved in the data interpretation and not the analysis phase. Especially when there may be times where complex software or things of that nature may be needed, and training and skills to use those softwares may be needed in order to do that initial analysis. So that aspect of the quantitative analysis and structuring that data collection and use of that software could be a hindrance, and thus community partners may only want to be involved in the interpretation, not in the analysis. But even within that, community partners can contribute ideas for analysis and offer insights into the realities reflected by the raw numbers that come out of that. They may be able to help refine questions that the data would explore, and make significant contributions to interpreting and synthesizing the results. And also, as I kind of mentioned earlier in the shared language aspect, that the community members unaccustomed with working with data were able to interpret results better when they were presented as percentages or in graph form, something that was more easily digestible, more of a shared language, something that it's more common for them to see. The second point here, community partners' roles and skills for data analysis or interpretation can be influenced by their prior experiences in research endeavors. This is also obviously, as we know, an important aspect of CBPR is capacity building. So understanding the past capacities of some of these community members and community partners based off their previous experiences, and how we can build on those past capacities to get them to be able to be a part of the data analysis and interpretation phase if that's something they've never done before. But they may have some level of fluency in it because of their interactions and past research endeavors. And also those who may have had some past experiences that are relevant or that make it easier for them to pick up on these things, they can serve as mentors for other community partners as well. So for this next slide on lessons learned, it's based off the question, how can academic and community partners anticipate the time and iterative process required? So this is definitely an important aspect, and something that they mentioned as being very important was data analysis and interpretation of findings being an iterative process, and making that very clear to everyone involved in community, including and especially community partners. It can be a very, very arduous process, and going back and forth and having to evaluate some of the codes being used. So making sure that that's laid out from the onset to let people know, especially community partners who may not have been a part of this kind of process before, or people from the university setting who may not be a part of this in a collective aspect before, for them to understand that this will be a process that will have a lot of give and take a good amount of time to reconcile all those different viewpoints being brought to the table. And also, obviously, framing how that process will even go, whether or not it's going to be through consensus process or what the case may be. Obtaining commitment from community partners reduces analysis fatigue and temptation to take shortcuts. As I mentioned on the last point, is making sure people are aware of exactly what the process looks like helps to then build that consent in moving forward, and making sure you have that before you actually jump into it, and understanding that this will be a long process, and not feel like you have to rush things at any point. Also, simplifying data can aid understanding, but also may obscure complex relationships. So I had mentioned earlier about the use of graphs and percentages and things of that nature. But it's very important for people to also bring to that conversation that these graphs and percentages may hide some things that may be revealed if you disaggregate the data in different ways, so that the community partners who may not be aware of that can know that, hey, there may be some other things we can do to position this data in a way that shows things that maybe this simple percentage or this simple graph or chart may not be particularly showing. So being very transparent on what the percentage and the graph may be showing and what it may not be showing is important when you're creating those simplified versions of the data. And as been mentioned multiple times, time required is lengthened considerably. As I said, one of the surveys or one of the CBPR projects said that it took 8 months to analyze and interpret the data. So for this last slide on the results and lessons learned, it's based on the question, is engaging all partners in data analysis and interpretation of findings worth doing and doable? And so this one talks about experiential learning approaches are effective in engaging community partners. And so that is really important because, through the visioning, through visioning the application of the data during these facilitated discussions, community partners are able to incorporate the information that they saw into their lived context and their material realities, and be able to see the direction of where this data can drive the action towards. So that's always, from my experience, really helpful in the learning process, is being able to apply these maybe abstract concepts into your everyday life to be able to understand and digest them better. This has roots in pedagogy and Paulo Freire, and so these are very helpful aspects in the involvement of community and data analysis and interpretation in enriching their understanding of how these research findings are able to engage in their lives. Community partners' roles and skills for data analysis or interpretation can be influenced by their prior experience in research endeavors. I had mentioned that earlier. As they're able to have more experience in this, in these different processes, they're able to um, build on their capacities and share and mentor of others. Um, yeah. And the last one, including the community and data analysis interpretation, or both, can increase authenticity of findings. This is was came up as important in the Latino Soccer League case, where through multiple revisions of the focus group codes, the partners produced and interpreted themes that were more trustworthy and representative in their view of the local Latino community than of the coalition in general. And so being able to reconcile different people's views within this analysis and interpretation to create greater levels of authenticity. Um, and better reflect the broader community and navigate certain power dynamics that sometimes elevate certain people's voice or ability to analyze over others. So, for the conclusions of this study, they concluded that the value added through exchanges of language and cultural insight, that there was value added through exchanges of language and cultural insight in data analysis, that CBPR partners are uniquely positioned to take lead roles in data analysis and interpretation of findings. Um, in each of the cases that they highlighted, all their involvement, the community involvement in data analysis and interpretation, strengthen community capacity building and increase community members' ability to understand complex issues that affected their health. So not only did the community's participation in data analysis and interpretation enrich the analysis and interpretation, but it also enriched the community's understanding of the issues that are affecting their health and increase their capacity as well. Also, they highlighted that there is no correct approach or one correct approach to including community in data analysis. Sometimes there would be inclusions in data analysis, sometimes only in the interpretation, sometimes in both. So understanding what's the appropriate situation for your particular study can be an art and a science in its own, but that's something that should be negotiated within community. The roles and skills of community partners were found to be different from and complementary to those of the academic partners. This is actually a quote taken from the article, and they put "but" instead of "and," I thought that it was probably better to put "and" in this sentence for the simple fact that "but" is more of an exclusionary term there instead of "and" being more inclusionary, where the view that roles and skills of community partners are viewed as different usually is juxtaposed against that they won't complement the academic partners, that the academic partners, and this is based off maybe more traditionalist views of research, but changing that to "and" I think is a powerful way to approach that. Also, these observations reaffirm the premise that the issue is not who has the requisite knowledge and skills for data analysis and interpretation, but rather how such knowledge and skills are generated, shared, and applied, which I think summarizes all of these 4 points, and it's a direct quote from the article. So for the questions that I came up with in this, I've been thinking about my own research, and though it's already done, how would I have redone it if I could? So just thinking about your current research ideas and using CBPR for them, how would you approach data analysis after reading this article, and what complementary skills do you see community partners bringing to that data analysis and interpretation? Again, looking at it, are you going to use quantitative, qualitative? What kind of skills are required? And does community have those? Can they obtain them? What is it worth it? What parts of the process should they be involved in that analysis and interpretation? And then how do you view that they can enrich it? So for the second question, how would you handle the complexities of language and CBPR projects given the example shown in this article? So as I mentioned, there was multiple situations where there were multiple languages spoken by the community partners, and some people who were not bilingual and didn't speak the same language. Use of interpreters, use of maps, use of graphs, use of percentages as maybe some unifying languages, as well as allowing people to speak in their strongest languages. How would you navigate those things if you were put in that situation? And then finally, this is something that kind of came up in my own reading, which I thought was interesting. I'm very familiar with the community of Williamsburg and saw them as a component that, or one of the studies that were highlighted here and interpreted. Um, and knowing that Williamsburg in the 1990s and 2000s is a very different community than Williamsburg now, curious, and I don't know this to be fact, but curious if the various community initiatives in Williamsburg to improve the infrastructure and health outcomes, amongst other things, there contributed to the eventual gentrification of that neighborhood, which exists now. Williamsburg is far from that impoverished community that is mentioned in this article. So, asking what role do we play in ensuring that the benefits of CBPR are experienced fully by the community that participated in the creation of its benefits? And so I used a satirical headline from a Onion article. Trees planted in poor neighborhood mature just in time for gentrification. But thinking about that in broader terms, in terms of CBPR, of are these health outcomes that we're promoting through the improvement of the policy and infrastructure of these neighborhoods going to be fully realized by these communities, or will it make them prime for gentrification? And maybe that's not an or, maybe it's an and or. Make them prime for gentrification, and what kind of commitment do we have as people participating in these processes, whether as academics or practitioners, to ensure that those people who were a part of doing the laborious efforts of improving these infrastructures actually get to reap the benefits of them, the long-term benefits at times. So that's my three questions, and that's all for my presentation. Thank you all, and